guys, it's Hina, Sheth, and
Elayne, Geba
at Rebalance Physical Therapy, and we want to teach all of you guys out there the number one exercise that's super, super important for a variety of different reasons, but especially postpartum. This is something that every woman, no matter if you've had a C-section, no matter if you had a vaginal delivery, that you guys should know how to do this exercise because it's the single most important exercise before you start working out, before you start running again, before you even really start doing your everyday tasks to even manage your household, taking care of your baby, etc. So now, after you deliver, again, either C-section or vaginal delivery, you're gonna have some compromise in your abdominal musculature as well as your pelvic floor musculature, because of just the growing baby for the past 8 to 9 months that you've been carrying. Now the muscles that are really important, it's the deepest layer of your abdominal muscles, is called your transverse abdominal muscles. And the reason why this muscle is so important to improve is because it actually stabilizes your pelvis, your low back, and actually plays a role in decreasing or preventing incontinence, as well as decreasing pain, and also just in terms of alignment as well. And also something called your Diastasis Recti, which is a splitting of the abdomen that can happen in many, pretty much happens during all pregnancies, but it can continue postpartum. It helps to stabilize and sometimes help close that diastasis. So I'm going to be teaching or doing a demo on Elayne here, and then what I want you guys to do is start performing this on your own. Now, there can be a lot of different ways that you can compensate when you're doing this exercise, so we're not going to go into the full-blown how are people compensating, but just realize that you can compensate and use lots of different muscles, and if you feel like you are doing that, then you really do need to have this evaluated appropriately. So, what you want to do first is you want to get into a good, what's called pelvic alignment. And in order to do that, the easiest way is place one hand on your pubic bone. So Elayne, actually use this hand on your pubic bone. One hand on your sternum. Okay. And what you want to do, actually place it right there. Yep. And what you want to do is make sure that your pubic bone and your sternum is in good alignment. Now, if it's not in good alignment and you feel like the pubic bone is either tilted way too forward or maybe tilted downward, then you want to get that neutral. And you're going to do that by rocking your pelvis either backwards or forwards to get this into a straight line. So once you have that, then you can remove your hands, okay? Keep that posture. Now place your hands right about an inch above and an inch in, okay, from the two pelvic bones that you feel on your pelvis. So here are the front pelvic bones. So Elayne, you're gonna put your hands here. Go up in about an inch and go in about an inch, and you should be on the area of your transverse abdominis, okay? And what you wanna do is take a deep breath in, good, and take a breath out and go shh on the way out. And as you do that, you should feel a tensioning underneath your fingers. And the tensioning should feel like, almost like saran wrap going over a bowl. If you feel that tensioning happening, then you've engaged the transverse abdominis, which is good. But if you do that and you feel something bulging into your fingers and it doesn't feel like saran wrap, then it means that you're probably using or compensating with your other abdominal musculature. So what you want to do is you want to take a breath in and do the shh out. And when you feel just that tensioning happening underneath your finger, again, like saran wrap going over a bowl, that's when you want to stop. And then maintain that contraction for about 10 seconds as you then breathe normally in and out. And then you can let go of that contraction. And that would be one repetition. And what you want to work your way up to doing is about 10 times, holding about 10 seconds, and you can do this about 2 to 3 times a day. Now, once you feel like you've mastered this, then you can do this in other positions, such as sitting, you can do it in standing, you can do it on all fours. You want to kind of get yourself in other positions and try and see if you can do this in various positions. Once you can do this, then you want to incorporate this into all your other workouts. Before you do any type of movement, whether it's a bicep curl, whether it's a squat, whether it's a yoga move, you want to engage these muscles just to that little amount before you do any other movement. So, do you have any questions, Elayne?
No.
Great. Okay, so if you guys have any other questions, feel free to contact us on our website. If you feel like you are compensating, you don't feel like you're doing this right, and again, you can compensate easily by either over squeezing your glute muscles. You can over squeeze your abdominals and feel that bulge underneath your fingers. You might actually feel like you're not breathing well if you're engaging these muscles, or you might be also gripping with your inner thigh muscles. If you're doing too much of that, then you probably need more formal instruction on how to do this exercise appropriately. So I would say then find a pelvic floor therapist in your area, or if you're in the Philadelphia area, then obviously you can give us a call or come in and see us, or inquire on our website, which is www.rebalancept.com. And I hope this was helpful for many of you out there, and I hope you have a wonderful rest of your day.